Hi, everyone. We're going to go over chapter 22. That starts on page 355. It's drug therapy for gastrointestinal problems. All right, so let's first talk about drugs for nausea and vomiting. Of course, for drugs for nausea and vomiting, they are called antiemetic drugs. They do control nausea and they prevent vomiting. And usually nausea and, occur together normally, the nausea in the vomiting. Find why is the big reason. We need to find why we are having nausea and vomiting, and we need to realize how we can fix that problem. So that's what we're looking for. So example, like chemo patients, we know nausea is a big side effect of chemotherapy. So what we want to do is make sure that we medicate them before they go to eat or before they go for therapy to help prevent that nausea and vomiting from occurring. So there's reasons why things are happening. It's just figuring out why are they having nausea, why are they vomiting. So those are some things that we have to look for. So on page 357 in the book, there's some on table 22.1. These are some causes of nausea and vomiting that you can look at. Of course, we know a lot of drugs cause nausea and vomiting because we've seen our little side effect category, some infections, some like post-operative things. So those are some things you can look at, but some causes of nausea and vomiting. Now there are different type of antiemetic drugs that we're going to be talking about, and those are going to be starting on 358 in the book. Now our antiemetic drugs, there are going to be 5 types that we're going to be going through. There's the phenothiazines, anticholinergics, antihistamines, our 5-HT3 receptor antagonist, and our dopamine receptor antagonist. And those are going to be on page 358 to 359. And you can see the different ones. So with these ones, with the phenothiazines, promethazine or Phenergan is a big one that we've had used in the past. We haven't been using much of it, especially IV-wise, because it has to be diluted very well. This medication, if you push it, will cause a lot of problems with the vessels. So we haven't been using much of it, but it is out there. You can give it IV, you can give it IM, you can give it PO, you can give it rectal. So there's different routes of giving it. But like I said, they are not recommending giving an IV. In order for us to give it, pharmacy has to mix it because a lot of people are having problems. They weren't diluting it well enough and people are given issues. But the big thing with promethazine to remember is that it does cause some sedation as well as it can cause confusion in a patient. So those are some things that you may want to look for, know the patient's mental status beforehand. But promethazine is out there. It is a good drug. A lot of patients love it. Prochlorperazine or compazine, that's the second one. We do use a lot of that. Scopolamine, haven't used that a lot. In the past have, but not like recently. Cyclizine, have used that. Now meclizine is a big one that we use in the antihistamine category. Meclizine is actually what we use for people who are dizzy. The brand name is called Anavert. So when anybody has vertigo, usually we prescribe them meclizine, and that will help with that. And then on the 5-HT3 receptor antagonist, on ondansetron, which is Zofran, that is usually now the drug of choice that we've been giving for nausea and vomiting. We will give that first. If they're allergic to it, then we will try probably prochlorperazine, or we'll even try some metoclopramide, which is Reglan. And that is the next one with the dopamine antagonist. You have metoclopramide, which is Reglan, and trimethylbenzamide, which is Tigan. Not much Tigan like we used to do, but we do still offer. But like I said, out of all these, the ones that we give the most is the ondansetron, which is Zofran. That is the biggest drug. We can give it IV, oral. They even have ODTs where it melts on the tongue. So those are some things that we were going to talk about. So those are the common ones. Now side effects for these antiemetics, and that is going to be on page 359 in the little thing. Of course, each drug will have its own side effects, but the most common ones will be dizziness, fatigue, drowsiness, headache, blurred vision, and constipation. Okay, so with this medication, safety, safety, safety is going to be a big issue just due to the fact that it causes dizziness, it can cause fatigue and drowsiness, headache. So it causes a lot of neurological aspects, but can cause blurred vision and, of course, the constipation. So it's going to dry us up. And then you can think about that also with the antihistamines and that, those dry you up. Metoclopramide or Reglan, it can actually cause mild to severe depression. So it's very important if you have a history of depression to report that, because that's going to be something that they need to know. So a history of depression, you need to report if you're on metoclopramide or Reglan, and that's something you probably should know. Also, another thing is that prochlorperazine or compazine, it can cause some pink or reddish brown urine. That's not uncommon. But a big thing also with it that you need to monitor is it will decrease your sweating. So you have to avoid heat, and you need to check your temperature every 48 hours while on the drug, because the fact that it will actually decrease your sweating ability and cause issues. So you check your temp. If it increases and any amount, then you need to notify the physician ASAP. So when you're on prochlorperazine or compazine, you do need to check your temp frequently. If it does increase, then you need to notify something ASAP. Now, another thing also is metoclopramide or Reglan. Very, very not uncommon to hear gurgling of the stomach. You'll hear gurgling sounds, because what it does is it will increase your peristalsis. So a lot of times, and we'll be talking about that in the GI, but metoclopramide or Reglan, besides checking for depression, because it can cause severe depression, it's not uncommon to hear your belly sounds start gurgling more, because it does increase peristalsis in the abdomen. So those are some things we got to watch for. Now, adverse effects, on the other hand, neuroleptic malignant syndrome. Okay, this is very important. Neuroleptic malignant syndrome, it can actually kill you. This is when your body temperature gets really, really, really high. That's why it's important to monitor temperature of the body. Signs and symptoms of this will be fever, respiratory distress. You will actually decrease your respiratory rate, increased heart rate. You can have seizures, diaphoresis. You'll have blood pressure changes. You can be pale, fatigue, muscle stiffness, and loss of bladder control. So that's why it's important to monitor temperature and report if there's any change in it. Now, another adverse effects is if you're on trimethylbenzamide, which is Tigan, you have a high risk for coma and seizures. Coma and seizures if you're on trimethylbenzamide, which is Tigan. Now, another adverse effect is tardive dyskinesia. We've talked about tardive dyskinesia with some of the other meds. This affects the nervous system. It's uncontrolled rhythmic motion or movement of the mouth, face, or extremities. Lip smacking, that tongue thing drives me crazy. Puffing of the cheeks. Uncontrolled chewing, rapid worm-like movement of the tongue. Those are some things that can occur with these. It does start, especially if you're on promethazine, which is Phenergan, or metoclopramide or Reglan. You can be on the drug continuously, but after 1 year, if you don't report it, then it's irreversible. And if you catch it early, you can reverse it. So if they do start getting some of those tardive dyskinesia things, if they get it within a year, good. After a year, there's no reversing it. So the earlier we get it, the earlier the signs and symptoms, the earlier we can report it, the earlier we don't have tardive dyskinesia. So that is something that we need to teach the patients. Another thing that happens with adverse effects is promethazine and prochlorperazine can cause neutropenia. So we know if we have neutropenia issues, that's decreased white blood cells, which puts us at risk for infection. Also, like I said, promethazine or Phenergan, very, 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 very bad for the veins. If you give it IV, tissue necrosis, and it actually can cause burns. That's why I said they stopped giving it to us, because of the burning issues, and people were not diluting it appropriately. So if it's a must, then pharmacy has to dilute it and deliver the bag to us so we can give it appropriately. Another thing promethazine does, I told you that it can cause confusion, it can make you very sleepy. It also can decrease your respiratory drive. So it's very important to monitor these patients who are on promethazine or Phenergan very, very closely, especially our older population. Those ones are the ones that really, 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 really have issues with it. So what are we going to do before we give any of these meds? Of course, we know if we're going to give prochloroperazine, we're going to be making sure we check that temperature. So we're going to check a temperature, we're going to do blood pressure, heart rates, and cardiac rhythms, respiratory rates, as well as the level of consciousness, because we know these medications affect the neurological status. We may want to get a weight as well as check the electrolytes, because think about it, if you're vomiting, your levels are going to be off. So we want to check those electrolytes to make sure that you're okay. We're going to ask what's causing the nausea and vomiting. Maybe you ate something, you got nauseous. Maybe a certain smell made you nauseous. Maybe you're having pain and you're nauseated. So we need to figure out why you're having some nausea and vomiting. We're also going to ask about allergies, as well as any other medications that you're going to be taking. We want to make sure we ask about those. We want to know, do you get motion sickness? Because some of these medications can help with motion sickness. We also want to make sure we listen to bowel sounds. We want to check the abdominal area. Is it distended? We're going to ask about diet, their fluid intake, as well as their bowel movements. Are they having diarrhea? Are they constipated? How many BMs have they had? When's the last time they had a bowel movement? What did it look like? We're also going to ask about, is there any problems swallowing? I mean, are you choking a lot? Are you unable to keep down something? Maybe when you drink something, all of a sudden you're like, and up it comes. So we need to know about problem swallowing. Also, remember I told you if you're on metoclopramide or Reglan, this medication can cause depression. So if you have depression, you need to know if you're taking metoclopramide, it could get worse. So it's very important to report to the doctor if you have any signs and symptoms of depression while you're on metoclopramide or Reglan. And like I said, IV, dilute the med, especially Phenergan. It needs to be diluted big time because it can cause necrosis. And very important to avoid alcohol while on these meds, because think about the neurological effects that it causes. It's going to cause more problems. So stay away from the alcohol. After we give these meds, we're always going to monitor for the nausea and vomiting. We're going to ask, hey, did the medication work? Anytime you give something, you need to recheck and make sure that the medication was effective or not. If not, then sometimes we need to call the doctor and get it something else, or maybe give them another dose. Check a full set of vitals, including a temperature. Weigh self daily. We're listening to the bowel sounds, and we're checking for abdominal distension. We're going to report any respiratory depression. We're going to report any adverse effects. Older patients, we're always going to monitor their level of consciousness. That's going to be a big thing with them. And we're going to change positions slowly. It's very important to check the intake and output on patients, especially if you're vomiting. We need to know if you're keeping enough fluids in and if you're urinating enough. And if you're on metoclopramide, Reglan, you may need a different medication if you start having any signs and symptoms of depression. And also remember what I said about metoclopramide and Reglan. Besides the depression, it's normal for that gurgling sound in the abdomen. This is due to increased peristalsis when you're on metoclopramide. So that's a normal thing that occurs with it. We're going to teach patients drowsiness, safety concerns is a big issue, safety, safety, safety. Any signs of neuroleptic malignant syndrome or tardive dyskinesia, we're going to teach them the signs and how important it is to report it as soon as those signs and symptoms occur. And also check a temperature. Prochloroperazine or comfazine, like I said before, urine can change color to a pink or reddish brown. This is normal. It will go away after the med is discontinued. Drink a lot of fluids. You need foods high in bulk. Exercise will decrease the side effect of constipation. And take nausea med before the incident occurs. Okay? Make sure you don't want to be nauseated and then vomit everything up. So always take your medication before the incident occurs. If you miss a dose, take as soon as possible. Don't overdose on it. At least 30 minutes prior, you should take it for motion sickness. So before you go out, Take your medication 30 minutes prior to going out and doing activities that are going to cause motion sickness, like driving and that. Chemo patients, we give antiemetics 30 minutes before a meal. Our pediatric population, metoclopramide or Reglan. In children, it will cause muscle spasms of the jaw, neck, and back, and it will have jerky head movements and face. Higher doses, if they use it in the cancer patients, can actually cause balance problems. And our pregnant breastfeeding population, always check with your OBGYN. Metoclopramide is not good at all to use. Now, our older population, again, safety, safety, safety. Increased side effects of the confusion and dizziness. That's why it's very important to know what their normal mental status is. Long use of metoclopramide can actually cause shuffling walk, trembling, and shaking of the hands in our older population. So we got to be very cautious with metoclopramide or Reglan in our older adults. And high doses, as well as like with the pediatric, high doses of antiemetics for cancer patients in our older population can actually cause balance disturbance. So that's an issue. So that is information about nausea and vomiting. Next, we're going to talk about is constipation. Now, constipation, that is fewer than 3 bowel movements in a week. It's the decrease in the frequency of having a bowel movement. Stools are going to be harder than normal. You're going to have a bloated sensation. Bowel still full even after you've had a bowel movement. Now, it is a symptom. It's not a disease. There's some other issue going on. So that's what they have to figure out. You can prevent constipation by doing other things like increasing your fluid intake, increasing your fiber, as well as increasing exercise. So some things that you can teach the patients. Now on page 362 of the book, let's see, on that box 22.1 are some common causes of constipation. Abusive laxatives are a big one, especially in our older population. Dehydration, because your body's holding onto the fluid, it doesn't want to get rid of it, so you're constipated. Ignoring the urge to go, like if you have to have a bowel movement, you're supposed to go have a bowel movement, not hold it in. Not enough not enough activity, bad diet, a lot of things can cause constipation. Opioid use can cause constipation. So those are some things that we have to monitor. Now on page 383 are some drug categories that can cause constipation. So you can look through those and see the different, like iron is a big one. Opiates, we talked about, antipsychotics, so there's many drugs out there can cause constipation. And we've talked about some of those as we went through the thing. Constipation more than 3 weeks or bleeding, consult with a doctor. If you're still having problems after treatment, you need to be checked for colon cancer. Constipation with bleeding, abnormal pain, cramping, nausea and vomiting, and weight loss, that should be something reported to the doctor because that could be an issue with colon cancer. So you should be checked for that. Notify your OB when constipated during pregnancy and breastfeeding because they can, work with you in accordance to what you need to take and do. So that's what we have to worry about that. Drugs for constipation, there are different types. We have our bulk forming laxatives, which usually work in 12 hours, but can take up to 3 days to work. We have stool softeners. We have lubricants. We have saline laxatives. We have stimulant laxatives, which will actually increase the peristalsis. These medications are not for long-term use. Now, this is important, not to be used for longer than 1 week unless prescribed by a doctor. So no more than 1 week. Only exception is Psyllium or Metamucil. This is a type of bulk forming med that can be taken daily for long term. So only for 1 week, except for Psyllium or Metamucil. You can take that on a daily basis for as long as you want, and it's not going to cause a problem. That's the only med that you can take, Psyllium or Metamucil. Otherwise, the other ones, no longer than 1 week unless the doctor says otherwise. So on page 364 and 360, 364, these are the common drugs for constipation that we have out there. Methylcellulose is a citracel. Psyllium or Metamucil, that's the bulk one. That's the only one that you can give on a daily basis. Docusate, which is colace, that's a stool softener. Then we have the docusate sodium and castorol, which is colace, um, pericolase, and that's a stimulant one. We have bisacodyl, which we use Dulcolax. The osmotic laxatives, lactulose, we use a lot of. Magnesium, hydroxide, milk of mag, big one. Polyethanol glycol colately, that's another one we use. Sodium phosphate, those are Fleet's enemas. And then lubricants, we use glycerin suppositories a lot, especially for the children. When they're constipated, we'll use a glycerin suppository for them. So a lot of those we use a lot of medications for. But like I said, only for 1 week unless prescribed by the doctor, except for Pacilium or Metamucil, which you can use on a daily basis for long term. Now, side effects for these, they vary with each drug. And you can see that on page 365, that each one has different ones. But the common side effects are also in that little box. Common side effects, diarrhea, abdominal cramping, abdominal distension, and nausea. So we're talking about a Taco Tuesday here. And that does occur with it. So those are the common side effects for the medications. Now, adverse effects. Pacilium or Metamucil and docusate or colace can cause allergic reactions. Okay, you can have problems breathing, closing of the lips, the throat, closing, swelling of the lips and the tongue, hives. That's something we need to go to the emergency room ASAP. Castor oil or purge can cause confusion, irregular heartbeats, muscle cramps, skin rashes, unusual tiredness or weakness. This is something we need to report ASAP. We don't usually do a lot of castor oil like we used to. Lactulose, okay? There's sugar in lactulose that will increase sugar, so we have to watch our diabetics with that. Bisacodyl or Dulcolax will decrease your potassium level, which can cause dysrhythmias, so we need to monitor that. And Fleet's enemas will cause electrolyte imbalances. So those are some adverse effects for these meds. So before we give these meds, list of all the medications, know any allergies, know what the bowel pattern is and consistency of the stool, look at the abdomen for distension and listen to bowel sounds. Vital signs and weight are very important. Blood glucose level, especially if you're diabetic and you're taking lactulose. We're going to ask about abdominal pain. Never to be given to patients experiencing undiagnosed abdominal pain or acute abdominal pain. These meds can increase peristalsis and can put risk of bowel perforation. So we would never give it to anybody experiencing undiagnosed abdominal pain or acute abdominal pain. They should take a full glass of fluids with these meds, especially the oral ones, about 8 ounces. Antacids 1 hour before or 2 hours after. Lubricate suppositories before you give them. Don't be mean and always put the tip end in, not the blunt tip. Afterwards, recheck blood sugar with our diabetics. Also check bowel sounds and abdominal distension. Monitor the bowel movements. Have anything changed? Is it working? We do want to encourage them to drink at least 1,500 to 2,000 milliliters of fluids daily to prevent the constipation. Teach patients 8 ounces of fluids when they take the pills. Monitor their bowel movements. Like I said, 15 to 200 milliliters of fluids. Short term, except for bulk forming drug, Pacilium or Metamucil. Call if constipation is not relieved, if you have rectal bleeding or electrolyte imbalances. You start getting the muscle cramps, muscle pain, weakness, and dizziness. And antacids 1 hour before, 2 hours after, because it will decrease absorption if taken together. Encourage them to do a lot of fiber foods like cereals and grains, fruits and veggies and beans. The pediatric population, if they have a lot of times, if they have issues with their stools, we do just encourage the parents to try to increase their fluids. That is probably the best thing for the pediatric population. Pregnant population, talk to your OB/GYN. And older population, constipation is not uncommon. Meds are safe to take. We should encourage them to use Pacilium for preventive measures daily, increase their fluid intake and their fiber consumption, but they are a risk for fluid electrolyte imbalances. So we do have to watch our older population, especially our congestive heart patients and things like that. So that is information on constipation. Now we're going to go in the opposite direction and talk about diarrhea. And that's on page 366. Now, diarrhea, on the other hand, you have frequent need to have a bowel movement, abdominal pain and cramping, fever, chills, and generally feeling ill, weight loss. Symptoms of another problem are usually occurring. It should go away in a few days, even without treatment. If not, then we have an issue. In children and infants, it can cause dehydration, so we have to be very cautious with them. On page 367, you can see some common causes of diarrhea in table box 222.2. Of course, we talked about a lot of drugs causing diarrhea, especially those antibiotics that kill that natural flora. Food poisoning, some radiation, of course, some diseases like Crohn's disease, irritable bowel syndrome, those things can cause problems, nerve disorders, infections. So those are some different things that can happen. The Zollinger-Ellison syndrome, which is tumor that forms in the pancreas that will actually increase which will, increase the patient, like intestinal movements or so, which will form a lot of stomach acids and can lead to diarrhea. So that's some things that can occur with that. Now, the second one in box 22.3, those are some example of drugs that can cause diarrhea. And we've gone through some of those already. So those are some most common cause of diarrhea is enteritis, which is inflammation of the small bowel. A lot of people get that, which is not uncommon. But there are types of drugs for diarrhea. These are going to be on page 368 and 369. And there's 3 types we're going to talk about: anti-motility drugs, absorbent drugs, and anti-secretory drugs. So on these ones, let me see. The diphenhexylate with atropine, Lamotil, we give that. Loperamide or Imodium, who doesn't give that? That's like a common one that you can get over the counter. Adipulgite, which is kaopectate. Calcium polycarbophil, which is Fibricon. And of course, the anti-secretory drug, bismuth subsalicylate, which is Pepto-Bismol. So those are some, ones that we give common on. When we're talking about, we want to make sure, very important to make sure we keep our patients hydrated with these medications. We need to treat the cause. If we have to figure out why are they having diarrhea, and treat the cause. These only relieve diarrhea. We do need to watch for the electrolyte imbalances, especially the decrease in potassium level. Sometimes people have an infection. It can be due to a bacteria or a parasite. Diarrhea medications can make the condition worse. The drugs prevent the body from eliminating those organisms like the bacteria or the parasites in that. So we wouldn't want to give them these medications. So if you know someone's having infectious diarrhea due to a parasite or some type of bacteria, we want them to actually have diarrhea to release it. But we want to make sure we encourage them to drink lots of fluids to stay hydrated. Side effects on page 369. You can see there's common side effects for each anti-diarrhea meds, but think about it. It's going to go the opposite things. So we know we're having diarrhea. It can actually plug you up, so it can cause constipation. It can cause some abdominal discomfort, dizziness, as well as your dry mouth. It's drying you up. So think about those. Adverse effects, the calcium polycarbophil or Fibricon can cause intestinal obstruction. The anti-motility drugs, example, loperamide or Imodium, can cause toxic megacolon. And that is a big thing, and that is on page 370. And it is an inflated colon with abdominal distension. Their colon actually fills up with air, it blows up. So toxic megacolon, big, big, big toxic megacolon, colon. And signs and symptoms of toxic megacolon are fever, abdominal pain, rapid heart rate, dehydration. You can go into shock, which will lead to death if not treated. The concern is when patients are unable to button their pants or nothing's fitting because of the abdominal distension. And that usually, like I said, that happens a lot with taking medication, especially like loperamide or Imodium can cause toxic megacolon. So this is just an inflated colon, happens with diarrhea medication, and we do need to treat it because if not, you're going to have some issues. But the colon actually swells up, and like I said, you can see that on page 370, a picture of toxic megacolon. So those are some things to be very important about. It's very, very much a concern, especially when they can't button their pants. Like I said again, button their pants. So before we give these meds, check for abdomen for distension, and also check for blood sugars. Check for bowel sounds. List of all meds that they take, weight, as well as vital signs. We're going to check our skin turgor, make sure we're not dehydrated. If you have an allergy to aspirin, you do not give bismuth subsalicylate, Pepto-Bismol. It contains aspirin, like drug. So we have to watch for people who are on warfarin or Coumadin, or people who are allergic to aspirin. They cannot take that medication. They cannot take bismuth subsalicylate or Pepto-Bismol because it contains aspirin. After you give, you want to check for bowel sounds and abdominal distension. Watch for that toxic megacolon, report it ASAP. Monitor vital signs, monitor the stools, check the skin turgor, drink lots of fluids to prevent dehydration, wash your hands frequently, teach patients don't double dose on the meds. If they have a dry mouth, sugarless gums, good mouth care, mouth rinses. If it's liquid meds, shake it before you give. Report if diarrhea is not relieved in 2 days. You shouldn't take more than 2 days unless okay by a doctor. Okay, no more than 2 days. That's very important to know. Do not take any anti-diarrhea medication more than 2 days unless prescribed by a doctor. Report any signs of toxic colon, megacolon. Report if there's any blood or mucus in the stool. Avoid alcohol because it can cause central nervous system depression with the meds. And remember, aspirin and Pepto-Bismol causes ringing in the ears. So if patients complaining of tinnitus, could be because of the increased aspirin level. It can also turn your stools and tongue gray-black. So if you're on Pepto, which is then it's not uncommon to have your stool and your tongue turn a gray-black. Pediatric patient, no Pepto containing aspirin. They do have pediatric ones that do have no aspirin containing, but we never want to give a child anything that contains aspirin. It has to be aspirin free because of the Reye syndrome, which affects the liver and the central nervous system. So we do never give them anything that contains aspirin, the pediatric population. They're at high risk for dehydration, so we have to make sure they're drinking enough fluids. And pregnancy and breastfeeding, always talk to your OBGYN. We definitely do not want our pregnant people to get dehydrated because it could put them into early labor. And our older population, increased risk for dehydration. They need fluid replacement. Our older adults over 60, no bismuth subsalicylate or kaopectate because they'll have more side effects of constipation. So that is chapter 22 in a nutshell. Hopefully everybody is doing well.